After a motorcycle accident, my doctor recommended amputating my right foot. He claimed I would never regain sensation and that it would only cause me problems for the rest of my life. I chose to ignore his advice and waited to see what would happen. 2 years later, I started experiencing severe itching in the foot, and within another year, I regained full sensation. Now, 40 years on, I can still do everything I need to, although the foot does ache a little when rain is on its way. Back in 1995, when I was 16, I had incredibly low blood pressure, 88/40, and was about 20 pounds overweight. My doctor at the time, known for his poor bedside manner, told me bluntly, "You're fat and no one will want to date you if you stay that way." I was completely taken aback. I'd seen doctors with varying attitudes before, but this one was especially offensive. His advice to fix my weight and blood pressure? Start smoking. Yes, in 1995, a doctor actually suggested that I pick up smoking. Instead of losing 20 pounds and becoming a smoker, I chose to drop 180 pounds by ditching that idiotic doctor. It was a patronizing and ignorant encounter. In my 20s, I visited a urologist and provided him with a list of my medications. When I mentioned testosterone cream, prescribed after tests revealed I had low levels, affecting my libido, he insisted I must mean estrogen cream. Despite my repeated corrections, he told me to go home, fetch the bottle, and spell out the label to him over the phone. This doctor treated me like a child, wasting both our time, simply because he didn't know women produce small amounts of testosterone, which is essential for their health. My husband once sought help from a local doctor for a severe earache. The doctor's wife, who also acted as his nurse, told him with a straight face that his ear pain was caused by evil spirits. He quickly left and found another doctor. Some people are just unbelievable. I had been feeling unwell for some time and was struggling with a persistent cough. I consulted several specialists, including an internist, an oncologist, a hematologist, and an ENT. The ENT told me that coughing irritated the throat and that if I simply stopped coughing, the issue would resolve itself. That piece of wisdom apparently required years of medical training. 11 months later, I was finally diagnosed with non-Hodgkin's lymphoma, with a tumor located in my chest. Chemotherapy cured the cancer, and thankfully, the cough disappeared along with it. I accidentally stabbed one side of my index finger with the blade exiting through the other side. Although I removed the knife immediately, the finger didn't feel right, so I went to a doctor. I explained that it hurt and that I was having trouble bending it. The doctor, however, dismissed my concerns, said it looked fine, and advised me to just keep it clean. When I insisted something was wrong, he smirked condemningly and sarcastically asked if I wanted a bandage. He applied the bandage with a grin and walked out. An hour later, I felt a sharp pain. The tendon had been severed and retracted down my finger into my palm. Surgery was required to locate and reattach the tendon, followed by stitches and physical therapy to restore movement. Months later, I underwent another surgery to remove scar tissue from the reattachment site, allowing me to regain better flexibility. That procedure also required stitches and additional therapy. Thanks for nothing, doctor, except for the Band-Aid and the smug attitude. "16 years ago, my wife survived a terrible car accident. She spent 6 weeks sedated in the ICU, had one leg amputated, required pins in her hip and pelvis, suffered nerve damage in her remaining leg, and had an infected degloving injury on her hip. Once she was stable, she was transferred to a hospital chosen by our insurance company. We met the head orthopedic surgeon there to discuss the next steps. We assumed he would explain when the pins should be removed, since the original well-respected surgeon had planned to take them out after the bone had strengthened enough to avoid infection. Instead, this doctor dismissed the idea entirely and suggested we go to Tahiti, relax on a beach, and drink Mai Tais. We were stunned and realized he didn't expect her to survive much longer, regardless of treatment. As expected, her wound became infected, cancelling a planned skin graft that likely would have failed. We returned to the ER at the first hospital where the metal was removed. After many more surgeries, my wife is alive and doing far better than anyone could have anticipated. At 22 years old, I was a first-time mum with a 6-month-old daughter. Life was incredibly challenging and money was extremely tight. After giving birth, my periods had been irregular, so when I noticed I was significantly late, I visited a walk-in clinic for a test. The doctor came in with the result and informed me that I was pregnant. Overwhelmed with anxiety about the thought of having another child at such a difficult time, I asked him, "What are my options?" hoping he could direct me to some assistance. His response left me stunned. "I have 2 daughters and I love them dearly," he said, and that was all. As I sat there, panicked and bewildered, I thought, "But I'm not married to a doctor," before he walked out of the room. Eventually, I was able to find the help I needed, despite my doctor's obvious pro-life stance and his unhelpful reply. For anyone inclined to criticize my decision, save your breath. I am firmly pro-choice, and this experience only solidified my beliefs. The life I would have faced and forced upon my children if I had been unable to access options is something I would never wish upon any woman or child, especially when alternatives exist.